Hi, it's Dr. John Perlman again, and I thought I'd relate another story or two about my experience in practicing plastic surgery over 30 years in Beverly Hills that might be of interest to you, and I think a demonstration of human nature and give some insight into human psychology. Often people ask me if I see a lot of patients who come in and want multiple plastic surgeries and seem addicted to it. And yes, I've seen a few patients over the years who are that way, but that's really quite uncommon. But what is much more common in my experience, and still relatively uncommon, but more common, is a patient who has poor self-image, poor self-esteem, who doesn't even focus on just one area, but perhaps multiple areas of their face or body that they feel are unattractive. And we have to watch for this because there's something called body dysmorphic syndrome, or disorder, body dysmorphic disorder, where we know that patients are not likely to be satisfied and made happy by plastic surgery, but are likely to either remain critical of the feature of their body or move on to other areas of their face or body that provoke dissatisfaction. And they can never be made happy by undergoing plastic surgery, and we have to recognize that, although sometimes it's very difficult. But I saw two young patients, actually a third also that I'll mention briefly, two young patients approximately 8 or 10 years ago who happened to be very similar. They came in maybe a few months apart. One was a male in his 20s, the other was a female in her 20s. Neither, I think, had had plastic surgery before, but as I discussed their requests and their needs with them, it became obvious that there was a long list of complaints that they had. Now, one could say neither of them was perfectly handsome, but very few of us really are, or perfectly beautiful. But both were attractive young people who were within the norm, I would have to say. But first we discussed the chin on one, and then she questioned me about doing something for her cheeks and questioned me about her breasts. And a few things came up, and it seemed suspicious to me, a little strange. As much as I liked her, she was a nice person, as was the young man. And I questioned both of them regarding their relationship with their parents in childhood. And both of them kind of startled, and as though I'd struck a chord, and admitted, I can't recall the details, but one admitted that he or she had a mother who was an alcoholic, and the other had a father who was very hostile and angry and critical. And they both grew up feeling that they were unattractive. They could never win the love of their parents. So there are 2 points here. One is to try to recognize when somebody's been affected in their childhood by a negative parental influence. It could also be a friend or a husband or lover, I guess. And the second is to recognize the importance of being kind and generous and nurturing to your own children. Never in a moment of anger should one go, oh, you're so ugly or you're so fat. I think it's a lesson I've learned through my experience dealing with patients in 30 years of plastic surgical practice, that there are very sensitive points in one's life where a negative word out of somebody of importance or who has control of us, such as a parent, in a parent-child relationship, can really impact the patient's self-esteem and feelings of self-worth for the rest of their lives. So when or if you have children, always remember that. Show them love, show them attention, make them feel good about themselves, and be very careful how you phrase things that might impact their self-image. The third patient I was going to mention to you was a little different. She also was in her mid-20s. This young woman had had multiple plastic surgeries and was dissatisfied as a result of the appearance of her breasts, despite the multiple surgeries. And not that I had not done any of them. So she came to me for another opinion, I guess seeking revision work. So after talking to her, I asked her to go to the exam room, and I examined her, and frankly, to the contrary, I found her results of her surgery, and again, I hadn't performed it, to be outstanding. So of course, my thought came to mind that I needed to inquire regarding her childhood, and boy, I have to say the reaction was quite different than it was with the first two patients. She became somewhat offended and couldn't believe that I couldn't see what was disturbing to her. I couldn't, to be quite frank, and in a mild manner kind of stormed out of the office. So I couldn't connect well with her. I should give you a follow-up on the other two patients. At the end of our consultation, when they both acknowledged that I was probably right, that their parents had influenced their self-image and self-esteem, they both agreed to see a therapist, and I offered to avoid charging them for the consultation if they promised that they would spend the money to initiate therapy to see if they could resolve those issues and not go through with plastic surgery. So just kind of an interesting experience in my life where I think I was of help to two of the three people, and possibly the third, by avoiding a suggestion or recommendation of undergoing the knife for what ailed them. Well, thanks for listening. I hope you find this little story interesting. Hope to see you soon. You can visit our website if you're interested in anything about plastic surgery that I perform at perlmanmd.com, Perlmanmd.com, or call us 310-854-0031. I look forward to hearing your comments. You can email us as well. Thank you and have a good day.